The state of Montana says there is an alarming increase in fentanyl-related deaths. The state crime lab reported 41 fentanyl-related deaths in 2020. That number in 2021 is already at 22. Fentanyl is a synthetic opioid. It was developed for pain management during the treatment of cancer patients and is about 50 to 100 times more potent than morphine. Montana state officials say due to its powerful opioid properties, fentanyl is illegally manufactured and abused.
The popularity of fentanyl has increased simply because we've gotten better at controlling opioids, better at the prescription. So when it gets harder to get an opioid from your physician, you're going to look for something else as a resource. It used to be heroin. When fentanyl is 100% more potent and you need less of it, all of a sudden it becomes more popular, even though the risk can be fatal.
The Department of Justice believes that fentanyl is being sold as a substitute for heroin. They say counterfeit pills disguised to look like legitimate prescribed opioids but contains fentanyl have been found in the state, which is why the DOJ partnered with the Department of Public Health and Human Services to send a message statewide that fentanyl is a risk to everyone.
There's a great risk to EMS and law enforcement if they encounter fentanyl simply because of it can be airborne and it can really have some difficult medical consequences. So we're certainly making everybody aware of it.
More than fentanyl, overall opioid overdose calls had a similar uptick this year. In March of this year, emergency medical services responded to 68 opioid overdose calls, the highest number of calls received in the past 3 years in Montana.
This is really about awareness. We rely on the general population to bring awareness to these incidences and to these concerning trends. And I think we all need to link arms together. That's how we're going to try to solve this opioid epidemic.
In 2020, Montana averaged 45 opioid overdose calls per month. Thus far in 2021, the state has averaged 54 opioid overdose calls per month. State officials are urging everyone to get familiar with naloxone. It is a medication that could be administered to anyone with a suspected overdose. It can save lives and is safe even if the individual did not take any opioids. In Helena, Alexi Guayo.